Good evening, everyone. Am I audible?
Yes, madam, you are audible. Good evening.
Good evening and a very warm welcome to everyone. On behalf of Anjuman College of Engineering and Technology, Department of Computer Science and Engineering, I, Professor Sadia Patka, take the privilege to extend my heartfelt welcome to our esteemed chief guest and keynote speaker, Dr. Ritu Jain Gaurav ma'am. Our today's eminent resource person, Dr. Gyan Shankar P. Mishra, Dr. K.S. Zakiuddin sir, Principal, Anjuman College of Engineering and Technology, Dr. M.S. Khatib sir, FDP Coordinator, Dr. Abdul Razak sir, FDP Co-Coordinator, Professor Nadish Khan ma'am, Head of the Department, Computer Science and Engineering, all the faculty members and their participants. I welcome you all on this 1 week ATALFDP on intelligent healthcare and medical systems. We are delighted to begin this session with the online unveiling of FDP banner in gracious presence of everyone. Just give us a moment. So let's unveil the banner in the presence of our chief guest. And we look forward to an insightful and engaging week of learning and knowledge sharing. Ladies and gentlemen,
clappings.
a very warm welcome to everyone. Now here, I take a moment to introduce our FDP coordinator, Dr. M.S. Khatib sir. Dr. M.S. Khatib sir is an associate professor in CSE department and Dean Academics at Anjuman College of Engineering and Technology. Sir has completed his PhD in Computer Science and Engineering from Sant Gadgi Baba Amravati University. Sir has 30 years of teaching and administrative experience in engineering college. Sir is the former chairman board of studies for computer engineering, information technology of Rashtrasan Tukaroji Maharaj Nagpur University, former co-opt member board of study, computer science and engineering at Sant Gadge Baba Amravati University, former member of board of studies, computer science and engineering, RTMNU. Sir has published numerous papers in national and international conferences and journals, and has been invited for an expert resource person in various technical programs. Now, I invite Dr. M.S. Khatib sir to brief all the participants about FDP.
Thank you, Madam Sadia. Am I audible to everyone?
Yes, sir.
Madam, yes. Namaste and very good evening to everyone. Honorable Chief Guest, Dr. Ritu Madam, our Honorable beloved Principal, Professor Dr. K.S. Zakiuddin sir, Co-Coordinator of this Faculty Development Program, Dr. Abdul Razak, Madam Nazish, Head of the Department, all dear participants, invited guests, resource persons, and all my dear faculty members. Indeed, it gives me a great pleasure to welcome you all to this AICTE sponsored online faculty development program on intelligent healthcare system. I extend a warm and heartfelt welcome to all our distinguished speakers, invited guests, participants for sparing their precious time. We are privileged to have registrations for this faculty development program across the country. To mention few states, we get the participants from Delhi, Rajasthan, Punjab, Gujarat, West Bengal, Pondicherry, Karnataka, Kerala, Tamil Nadu, Andhra Pradesh, and of course from Maharashtra. In all, total participants registered for this faculty development program are 175. At the outset, on behalf of the college, I would like to express our sincere gratitude to the All India Council for Technical Education for their support and grants, without which this faculty development program would not have been possible. AICTE's commitment to continuous faculty upskilling and promoting innovation in teaching learning process is truly commendable. The theme of this faculty development program, Intelligent Healthcare System, is both timely and transformative as we witness a digital revolution in healthcare. Technologies such as artificial intelligence, machine learning, deep learning, Internet of Things, big data analytics, and cloud computing are playing a pivotal role in redefining patient care, medical diagnostics, and healthcare operations. This program aims to equip participants with the latest knowledge, pedagogical strategies, and practical insights into these emerging technologies with a focus on their applications in healthcare. Over the next few days, definitely participants will be benefited from the various sessions by leading experts from academia, healthcare, institutions, and industry. We hope this program will serve a platform to spark ideas, foster collaboration, and encourage interdisciplinary research and teaching learning in this vital area. It is mandatory for the participant to submit feedback for every session collected through Google Form. For obtaining a certificate, participants should have minimum 80% attendance and a score minimum 70% marks in the online test, along with the feedback at the end of the program. Here, I would like to take this opportunity to thank our inaugural chief guest, Dr. Ritu Jain Gaurav, CTO, U2U Systems Pte Limited, Singapore, Honorable Z.A. Haq, Administrator Anjuman Ham Islam, Mr. Anis Ahmad, Chief Executive Officer, Anjuman Ham Islam, Professor Dr. K.S. Zakiuddin, Principal of the Institute, for always a motivating factor, guiding us and providing all resources for this faculty development program. I am also thankful to my fellow colleague, Professor Dr. Abdul Razak, co-coordinator of this faculty development program, Madam Nazish, head of the department, and all my team members, dedicated organizing team members who have contributed a lot, and their tireless effort will definitely make this FDP in a true sense a reality. Once again, I welcome you all and look forward to a productive, insightful, engaging faculty development program. Let us use this platform to learn, connect, and contribute to building intelligent and inclusive healthcare solutions for the future generation and towards the benefit of this free India. Thank you and best wishes for a happy and great learning ahead. Thank you one and all. Madam Sadia, over to you.
Thank you, sir. Now I take the privilege to introduce our chief guest and keynote speaker, Dr. Ritu Jain, ma'am. Ma'am is a founder and executive director in Swashanta Foundation, India. Ma'am is founder and CEO in U2U Systems Private Limited, Singapore, India. Ma'am was recognized among the top 130 women transforming India 2019 Niti Aayog and in top women voices and social innovation 2023-24 by Center for AI Innovation, Singapore. Ma'am has completed her Master of Technology from IIT Roorkee, major in Electronics and Communication. Ma'am has extensive technology and management experience, making significant contributions through her work and research like U2U Systems, Singtel Singapore Telecommunication Limited, Alcatel Lucent Private Limited Singapore, Lucent Technologies India, Motorola India Electronics Limited, Wipro Technologies, Cilentro Systems, now as Broadsoft or Cisco India. Ma'am has authored and published several books on cyber security. Ma'am is working with Singapore Skills Future to develop and transform education and help in transforming workforce through community learning, knowledge sharing, and knowledge development. Ma'am has been certified as a project management professional and agile certified professional. Advanced certification in training and assessment, Institute of Adult Learning, Singapore. I invite Dr. Ritu Jain, ma'am, for the
Madam
keynote.
Satya,
Yes, sir.
please, just
Yes.
sorry for interruption.
No problem.
Actually, I would request actually to use first, it will be fine that if you could allow our principal sir to address, and thereafter Madam Ritu shall be addressed.
Sure, sir. Sure.
Please, it is requested.
So I invite, here I take a moment to introduce our principal, Dr. K.S. Zakiuddin, sir. Sir has 32 years of teaching experience. So has completed his PhD in mechanical engineering from BNIT. Currently, sir is principal and professor in mechanical engineering at Anjuman College of Engineering and Technology. Worked in various capacities like associate dean, professor and head, dean academics, dean accreditation in past years, and has been a professor in Priyadarshini College of Engineering. Sir has guided various scholars, PhD scholars. Sir has various patents, one granted by Government of India, one is from Australian Government Innovation Patent granted. Various copyrights and awards like collaborative learning and kinematics of machine. Sir has been awarded with Maharashtra State National Award for outstanding work done in specified areas of engineering and technology. Sir has been awarded by Best University Teacher Award by Nagpur University. Awarded by IST UP government for outstanding work done in specified areas of engineering and technology. Sir has been selected to represent RTMNU at university level for best PhD project. Aviskar at 2008. Best paper awarded in 13th State Convention of IST Wardha, India. Global Achievers Award for Education Excellence 2013, New Delhi. Sir has been felicitated by His Excellency Governor of Uttarakhand, Honorable Dr. Aziz Qureshi. Sir has been awarded with National Award Outstanding Engineering Institute for Research and Innovation held at 15th World Education Summit 2019. Sir bagged India's Education Excellence Award in 2018. And there are many more to say, and my words fall short to describe his achievements. Sir has been invited for distinguished talks for 13th World Congress, Mexico, invited to deliver presentation in symposium at BU Amsterdam, the Netherlands, invited as a resource person for PhD course, workshop on research methodology and research publication ethics. Sir has been reviewer for IH&MS 2019 World Congress Poland, AICTE Student Learning Assessment Project, Research Advisory Committee member. So has been invited for adjunct faculty in Datta Meghe Institute of Medical Sciences and shortlisted in Atal Incubation Center in top 10 in India Atal Incubation Center. I request Principal Sir, Dr. K. Zakiuddin Sir, to address us with his words. Sir, you are not audible.
Sir, you are not audible.
Now, hello,
Yes,
good
yes.
evening.
Yes, yes.
Good evening, all respected chief guests of the function and dear participants. On behalf of Anjuman College of Engineering and Technology, I welcome you all for 1 week Atal FDP on Intelligent Healthcare Medical System. I also welcome our chief guest, Dr. Ritu Jain Gaurav, founder and CEO of U2U System Singapore. Welcome, ma'am. As
Thank
our
you, sir.
institute is A+ accredited by NAC, we are 25 years of technical education and we are managed by Anjuman Hamia Islam. It's a public charitable trust with 137 years of legacy in education. The trust is headed by the retired Justice Mr. Zaka A. Haq, who is a Bombay retired justice and a administrator. We are very pleased to inform that almost 175 participants all over the India have registered. Prominent among them are from Tamil Nadu, Kerala, Rajasthan, Punjab, Bihar, Karnataka, West Bengal, UP, Jammu and Kashmir. I hope all participants will have a great learning. Wishing you a happy learning. My best wishes to the coordinator, Dr. Mohammad Sharifuddin Khatib, and the coordinator, Dr. Abdul Razzaq, the head of the department, Ms. Nazish Khan, Professor Kamlesh, Dr. Manish Hasudani, Mrs. Patka, Professor Imtiaz, Hina Patan, and a very big thank you to AICTE for granting us this FDP. Thank you once again, our chief guest, Dr. Ritu Jain, she is from Singapore, getting connected. Thank you very much, and God bless you, ma'am. Welcome aboard. So we can say welcome back to India. So thank you from my side. Over to Mrs. Patka.
Thank you, sir. Madam,
Thank you, sir. Thank you. Now I invite Dr. Ritu Jain, ma'am, for the keynote address.
Good evening, everyone. It is my pleasure to be among the accomplished people who have held the torch for education from 100 plus years. It is my pleasure to be here and share whatever I have learned during my course of my life with and more, because it's a lifelong learning for us. We are learning every day. I am learning from all the people here, as well as I will be learning from all the people here. My accomplished speakers, I'm sure, are here. And I'm very happy to share my thoughts and the technology changes and evolution which we have seen in the last 30 plus years. I started my journey with Motorola India Electronics Limited in 1995. That was my first job out of college. And that time they were only hiring the postgraduates and electronics and communication engineers from the IITs. So I had a smooth entry into finding a job. Thankfully, I'm blessed. I think that's why I'm here as well, to be among the accomplished people, Professor Khatib, the principal sir, and of course the board which is running the trust. With that trust, from the trust, I am going to be presenting my slides, and for the 1.5 hours, 90 minutes, I will be sharing some part from the technology perspective on intelligent medical systems. So with your permission, I'll be sharing my slides. Just allow me to do that. So let me know if you are, if my slides are visible and I am audible.
Thank you, ma'am. With the permission of Chair, I declare that the Faculty Development Program is inaugurated. Thank you to all the dignitaries for gracing the inaugural ceremony. I request all the participants to stay connected. We will start the session in a while.
So do let me know if all the slides are visible.
yes, madam,
ma'am,
it is
it's
visible.
visible.
Okay, perfect. So
Yes.
in the
Thank you,
next
Sajia, madam.
yes, in the next 60 to 90 minutes, I will be talking about the changes in technology which brings to us the intelligent healthcare and medical systems from the perspective of a person who has been in technology from 30 years in the industry and has seen a lot of changes in technology since the day I have been in it. So please allow me to share the thoughts. And it's also that I've been here in Singapore from 15 years. And from 10 years, we have U2U systems incorporated in 2015, working in technology, core technology areas, product development, as well as in services. So we have a number of products which we are developing for our clients. So from the tech perspective, we are in the core of technology. So presenting intelligence, healthcare, and medical systems. What are they? Why do we need them? How the latest technology impact is going to change the future of medical and healthcare, and what we can do to adopt to those changes. So let's, I'll begin. I think a lot of this has already been spoken about me by ma'am. And I am so happy to say that I am a true Indian at heart. You can see a Singapore flag there. Yes, I've been in Singapore for more than 15 years, and fortunate Singapore has given a launch pad to me to be in the core technology. So I would be thankful to Singapore as well. But I was born in a small town in Uttarakhand, which is the now the capital of Uttarakhand. That time it was in Uttar Pradesh. So I was born in Dehradun, and I grew up in Dehradun for almost like 16 years before I joined my bachelor's in technology in electronics and master's in technology from IIT Roorkee. And as I said, my first job was Motorola India Electronics Limited. That was one of the first company which came to India at that time in hardcore tech. And I joined as software engineer and then learned a lot of technology post that. Fortunately, I've been blessed to be in technology in most of the companies in Lucent, Alcatel. I did not show up into the management roles, but mostly in the solution architecting, building tech systems, tech platforms, and hence grew. It went next level where it started U2U System Singapore, and also we started U2U MedPharma in India with a medical wholesale license during the COVID times, and followed by a not-for-profit organization in skill development, which is Shanta. It was launched. I was one of the founders in 2018. So during all the companies, all the three companies was started with the thought process of including technology in these respective domains. So we realized that we need technology not only in the hardcore tech, but also in medical and also in education. And hence, technology initiatives, these companies were launched. So I have been blessed, of course, and I was one of the top 130 women transforming India award by Niti Aayog for one of the idea which we had started the company in. Then I'm also being an author of 4 books in cybersecurity, and I'm a hardcore cybersecurity ethical hacker. You may call it ethical hacker. Yeah. And also I have been recognized as top women voices in social innovation in 2023 and 2024 by Center for AI and Innovation, whereby I spoke about how artificial intelligence can transform the security landscape, specifically the cybersecurity landscape. And hence, I am still part of the Center of AI Innovation Singapore and mentoring students for new developments or new startups like incubations. So I'm involved with CEAI Singapore, working with many of the students in various colleges and schools, helping them in the mentoring them, I would say, mentoring them for the various tech innovations. So that's about me. And so it gives a background of who I am, and therefore what my views from the position I have been in the last 30 years on technology changing the medical system. So intelligent healthcare and medical systems. So I would say that it is intelligence in healthcare and medical system, and how we can use this intelligence healthcare and medical system. And when we are talking about intelligence, we are not only talking about human intelligence, but we are also talking about artificial intelligence. But it's not about only artificial intelligence, but there are a number of technology areas, or we call them pillars, which will impact the healthcare and medical systems of the future. So I will be sharing my thought process on what are those pillars, what are those technology pillars on which the future healthcare and medical systems will be based. So let's see how the healthcare systems have evolved during the last decade or last 100 years. Initially, we started with traditional care, which is very kind of in the core of India. It's like Ayurveda. It's in the core of India, where our lifestyle is as simple that we are taken care by our day-to-day learnings. Like, for example, I would say that I grew up in Dehradun, which is a very simple place, very small town at that time. And the only thing we knew about healthcare in those times was when we used to have fever, or when we used to have any small illness like cold, which was there, then the only advice we will get from our parents was drink warm water, just take rest for 3 days, and after 3 days it will go away. And I want to tell you that it was 100% true at that time, because we didn't know doctors, the allopathic doctors at that time. So we were just simply following the home remedies, a glass of water, warm water with some specific spices like cumin and honey, and ajwain, and all the. So we used to just follow this traditional care, and our lives would be as simple as that. That changed, evolved into kind of a pharma revolution, which also became a digital revolution. And that is where we are today. So where we are is in the center, where we do take care of some form of equipments, some form of advices, some kind of advices. We have the digital systems which do tests for us, and based on those tests, we are advised the medicines. So the healthcare, the traditional care changed into what we are looking at currently. We are in the current scenario whereby we have the intelligent technology systems which do test, which help us do test, and also help us to become more healthy, or solve our issues. Now, what we are looking at in the future is where we are looking at is AI-driven systems. And I will be talking more about these AI-driven systems, or artificial intelligence-driven systems. Now, the difference between the digital systems and AI-driven systems is the digital systems were totally dependent on human intelligence. That means the doctors would would be the final decision makers. In case of advice or implementing the healthcare solutions, it is the human intelligence which comes at the main part. But with the advance of technology, and in the last decade, we have seen that the AI-driven systems are slowly entering into every field, every domain, and healthcare systems cannot be left behind. And we will be talking about why AI-driven systems in two ways. Why? Because the change which has happened from the digital to AI systems is quite understood when we look at what change which has happened in the technology. What the change in the technology is that in the last 30 years, while I had worked from a lot of technical solutions, most of the solutions was based on rules. That means if it was a software was designed in such a way that the software would follow a rule. So we will see this in software systems where we use if then else statements, when statement, case statements. So if we see that the decision making was based on specific rules, and these rules would define the human intelligence, would help the human intelligence, would guide the human intelligence to make decisions. However, as the moment as artificial intelligence came in, the artificial intelligence is based completely on data. That means that it is no more a rule-based system, but it is a pattern-based or a data-driven outcome. So that is where the changes has taken place in the technology, and healthcare cannot be left behind. So healthcare says that in this, we are not saying if these are the symptoms, then this might be the disease. Instead of that, now we are going to be looking at that what is the pattern. So if how much of data shows this kind of a pattern, and if that data shows this many kind of patterns, then the decision making is now driven by the pattern based outcome. And that's one of the biggest change in from the digital to the AI driven system. So we'll be looking at a pattern based outcome. So that is the next evolution of healthcare system. Now let's look at what are the so we see that how does it impact, what does it change. So we see that initially we were reactive, like we were treating the illness, we were like looking at, we got the symptoms, we found the illness, and then we would prescribe a medicine. But the change with the newer definitions of technology is that there is a role of real-time data. There is a role of wearables, imaging, genomics, smart hospitals. And the future, what we are looking at is a proactive healthcare systems. That means preventing the illness before the symptoms appear. Prevention, and this is a big change in the thought process all around the world, specifically specifically in healthcare systems as well, that instead of being reactive, the world is now looking as being proactive. And the pattern-based data-driven system helps us. Is the next evolution of healthcare systems. So there are these are some of the key pillars of intelligent medical systems, and these key pillars which we are talking about is the technology pillars. So they are not any other kind of pillars, not emotional, not psychological, not anything else, but the technology pillars of intelligent medical system. And each of these pillar is independent on its own, as well as they work together to help in a proactive medical solutions, proactive healthcare solutions. So we see that if there is a pattern of symptoms in, say, one country, and the same pattern emerges in another country, in another small town, then we are not looking at a reactive, but a proactive based medical systems for the future. So the intelligent medical systems are based, shall be based, and are based, and will be based in the future as well as in today on several technology developments. Not only artificial intelligence and machine learning, but IoT and remote monitoring. That is also one of the key pillars for intelligent medical system. Robotics and automation. And so this will also form one of the key pillars of intelligent medical system. Big data and cloud. Of course, when we are talking about pattern, then we are also looking at big data, which is the lots of data available to us, so that we can recognize the pattern. And based on the pattern, we can predict the illness, not only illness, as well as the solution to that illness. So here we are looking at, and cybersecurity and ethics, where how that will impact the intelligent medical system. We are going to be looking at that as well. So there are so many technology pillars for intelligent medical system, and we will see in the next slide that how they are going to be helping us to create the intelligent medical systems. So let me speak further on the key pillars of intelligent medical system, where you will see there is the top and there is an intelligent medical system. And these are the pillars 1, 2, 3, 4, 5. These are all technology pillars, as I just mentioned. They are all technology pillars. So we see that AI and machine learning will help us in predictive diagnostics. Pattern-based data will help us to predict what kind of diagnostics we are looking at. Now, instead of being reactive, we will be predictive. Also, it helps us to for new drug discovery. That means once you are, we can also, this technology advancement will help us to do drug discovery. For IoT and remote monitoring, again, there are wearables and helping us in the home care. So IoT is devices which we will be, many people are already started wearing in Singapore, but it's very common wearables in Singapore. And not only that, there are everyday newer ideas and newer wearables being developed for monitoring your heart rate, for monitoring your sweat, for monitoring your steps, if you are walking, your steps, for monitoring. So these are IoT monitoring devices, wearables, and they also are helpful in reactive medical systems, but we also we use them in IoT in the monitoring of so home care will also change because of these wearables that the patients and for the health benefits we may have it in the home care. Then there is about the robotics and automation, where this pillar will help is in the surgery, in surgery rehabilitation, in logistics. So where logistics implies the medical logistics, where how the medicines are stored and where the medicines are stored and how the medicines are delivered. So logistics about medical part. Then there is about this, another pillar is about big data and cloud, whereby we are talking about having intelligent health records. That means that you may have your lot of health records of a patient already available to the doctor before he can start the diagnostics. Also, big data and cloud helps in the population management, can also help in, so these the medical systems. Then we are talking about the cybersecurity and ethics, which is about the biases, privacy, transparency of data. So, and security of patient data, not to be used for unethical purposes. So these are some of the intelligent pillars, key pillars for intelligent medical systems. Some of the key pillars, key technology pillars, I would say. These are very much required. So I would just give a couple of minutes to see if there are any questions and if somebody would want to share something. Okay, let's go to the next slide, which is about the real world applications. So before that, let's look at how we can use these key technology pillars to develop the real world applications. So, right, so that is one of the important things in the next level of med tech or innovation. I would say med tech innovation, because each of these key pillars of technology we can use to develop the next level of applications. And some of the examples of the applications will come in the next slide, which is about, this is the real world application where they're already being used. So each of these technology pillars is already being used to develop the next generation medical systems, intelligent medical system. For example, for cancer detection, we are using the artificial intelligence imaging. For patient-specific treatments, we are using digital twins. For telemedicine and artificial intelligence tried in rural care, we are using artificial intelligence and telemedicine. And of course, for smart ICUs with predictive alerts, they are already available and they have already been developed as real-world applications. Now, these are the technology. Each of these use specific technologies, which are the key pillars, key technology stacks which we use to develop these applications, and they are not sufficient, but there is a continuous development of these technology applications and more, which we can use to for predictive healthcare future applications. So what are the challenges? So what are the challenges which come in with the intelligent medical systems? There are numerous challenges to overcome. One is about the data interoperability and integration. Now, this is a very important factor when we talk about building intelligent building intelligent medical system, because when we are saying that the outcome will be pattern based, and then data becomes a very important input, because if the data is not right, if the data is not coming from the right place, then it can lead to a different outcome. For example, I will give you is that many times the data is being collected is for a specific gender. Say, for example, a data collected for only one gender, and then the intelligent systems developed based on the data from that gender and then used for another gender. This can be a biggest risk. So this is one of the challenges which we need to overcome, is that from how the data has been collected, from where the data has been collected, and is that data being used for that specific target group. So this is very important challenge for data interoperability and integration. At the same time, data collected from one ethnic group in one country and intelligent medical system developed using that data from that country to be used to another ethnic group in another country will be it can be a challenge as well. So we need to, there is no right or wrong answer as of now, but yes, we need to be looking at not using the data blindly, but be very sure about what data has been used to develop the intelligent medical systems. Ethical AI, transparency, bias reduction. This is what I have just talked about, that it can be an important factor in building the intelligent medical systems. Building patient-provider machine trust. Again, trust is a very important factor in the specifically, and that is also an important challenge to overcome. Then regulatory and legal frameworks, which are challenges to be overcome for development of the intelligent medical systems. So that's some of the important ones. Then a future outlook. How do we look at the future with which kind for the intelligent healthcare system? We look at precision medicine powered by genomics, artificial intelligence, smart hospital interconnected with home care. So this is also we are going to be seeing very much in the future, where the hospitals are now connected to the home care, and hence alarms or can be raised right from home care to the hospitals. And that part we are already seeing a number of uh, we are seeing the number of projects being launched specifically uh, like in Singapore and in developed countries, whereby we see that newer hospitals or newer healthcare um, are now being also offering a connection to the home care. So this is one of the future we are seeing. Like even I there is a news of intelligent health hospital being launched in Johor in Malaysia, and it's also talking about how that hospital will be linked to the home care, and how the patients can get the can be connected to the directly to the hospitals through the home care. And this is whereas there it is just at the border of Singapore and into Malaysia, but it will provide that facility to the people in Singapore as well. So this is what the future is already here. It's not far away. We are seeing it, so it's already here. AI agents as collaborators and not replacement. It's that we have also discussed in various forums that it's AI will is not going to be a replacement, but all it will be an enabler. And human intelligence still will be the decision makers. So the AI, artificial intelligence, is not a replacement to a human intelligence, but it will act as a collaborator. It will help as an enabler. So human machine synergy for compassionate care, and that's again a futuristic outlook, but it is already here that there will be a together human plus artificial intelligence working together for a compassionate care in the intelligent medical systems, future intelligent medical systems. So in India, we already have know that the India is adopting very fast. India is taking a lot of steps, pretty much ahead in from many countries. And the advantage we have is we have a huge amount of tech people available, and it's a it the opportunity, it brings in a huge amount of opportunity for us to enable technology for healthcare. So we have government initiatives, we have the right regulations in place, we have the right technology of people available, we have a huge amount of investments into healthcare. So now it's like integrating all the three together: the regulations, the technology, and the health, the healthcare. So it is one of the biggest opportunity for intelligent medical systems, and for the future driven intelligent medical systems in India. So that this is about the that we know that it's not only artificial intelligence, it's a number of pillars of technology which can transform every layer of healthcare delivery. Innovation is ground. We know that innovation is the next step, and collaboration is the key. So these are the three important pillars of collaboration. One is the technology, like us, the people who have worked in technology for a decade, more than decade, for people who know the technology inside out. And then there is medicine, and then of course there is the regulatory body or the policy makers. So there was a time there was a time 30 years back when we were choosing our careers only as an engineer or a doctor. So now is the time where they come together. So we choose to be working together with the doctors and the regulators to launch an integrated intelligence healthcare system. And the accelerator to this is, of course, the artificial intelligence and the development in technology, which has happened in the last 20 to 30 years. So that's about the keynote. And I'm happy to take any this for a discussion. We can do a 10 minutes discussion, and want to understand your views before we go to the next. Hello, everyone. Yes, you can write your questions if you have anything. If you want to share something or discuss, please, you can write it onto the messages.
Ma'am, there is a question from one of the participants,
Mhm.
Iram Noshin. She is asking how to identify the authenticity of data. What are the different ways that are available?
Yes, so that is a very good question. How to identify the authenticity of the data, and it leads to two things. One is the ethical AI, of course, and the two is the trust in the provider. So that is one. And second, I want to talk about is that any intelligent system, any future medical intelligence system, if we are developing, right, if you want to develop, or if some organization wants to develop, there is a AI ethical rule to it, which is that the person who is developing the ethical intelligence medical system must own the data, right? So you cannot say you are developing an intelligent medical system without owning the data yourself. Now, owning the data may mean two things. One, you create your own data. That means you collect your own data. Two, you buy the data from a trusted source, right? So both are ethical. However, what is more trust in the data is you create your own data. So you associate yourselves where you can collect and create your own data rather than buying the data. So that's very important. So that is how the trust in the data can happen, that create your own data. Associate yourself with a medical college or a institute where you can get the data by yourself.
There is one more question. Is any specific sensor chip is available for leakage of blood in eye nerves?
So I won't know. I'm coming from the technology side. I am not coming from the medicine side. So it's not that I have all the answers. I will be able to help you in the from more on the technology perspective and how we can develop intelligent healthcare system using the evolution of technology which has happened. But if you're asking me domain specific question on medical sciences, I'm sorry, I'm not the right person. If somebody is here who can help, it will be very, very helpful. So we can discuss that also. Yes, it's digital twin is kind of a replica, and we call them personas in the technology terms that say exactly a person like me, not like look and feel, but the same symptoms, but the same, it's exactly, so it's called a persona. So if you replicate the persona of the person, and then it's like a digital twin. So that's why we are saying that it's no more a rule-based system, but it's a pattern-based system. If it's the same pattern repeated, then probably the outcome may be same.
Yes, participants, anyone else who want to ask question?
So we focus towards building of intelligent medical systems using the technologies evolution which has happened into robotics, into artificial intelligence, into cybersecurity, into different technological aspects, and then develop these intelligent healthcare systems for future to enable the practitioners. Who are the practitioners? The doctors, the caregivers, the healthcare providers, to enable them to make smarter decisions, or to enable them to be more productive in being able to do healthcare or provide healthcare. What is the role of AI in cancer detection? Fine, yes. So yes, we can discuss that in not only in cancer detection, but any disease detection. What can be the role of AI? How the AI, we will be talking in, I will be sharing another set of slides, and we will be talking more detail into how it is can be done, how this can be done, and how the technology works so it can be done. Sadia ma'am, is that the time? Please help me with the time. You know that
We can like go till 8.
8, 10:30. Okay, so that means we
Again,
have
happen.
1 hour, right?
Yes, ma'am, yes.
Okay, I'm going to be sharing another. This is the next slide set. It will be in. We discussed all the 5 pillars. Now we will skip the 4 pillars, and we will focus on the 1 pillar, which is artificial intelligence and machine learning. Okay, so we have that much of time for the next an hour or so, where we will be mostly focusing on 1 pillar for developing intelligent medical systems. All right. So I will be starting to share my screen, if it's okay. And please keep your questions, and then if we get a time, we will be able to answer. Else, offline, we can share the answers as well. So shall we go to the next level?
Yes, ma'am. Yes.
Okay. So this is so we have just in the keynote we have spoken about 5 pillars, 5 technology pillars which can help to develop intelligent healthcare and medical system, and are already developing intelligent healthcare and medical system. From those 5 technology pillars, that means each is a technology stack from those technology stack, we are going to be choosing the first technology stack, which is artificial intelligence and machine learning. And using that stack, we are going to be talking in the next hour how we can choose, how we can develop innovation, how does that technology work, and of course it will be able to answer some of your questions on predictions on diseases like cancers and including COVID, including any other diseases, how it works. So I'll focus more on how the technology works. So let's go to the next slide. So which is about artificial intelligence and machine learning in healthcare. That is one technology stack. And how does it work? How does artificial intelligence work, and how it can be used in the healthcare? So why, first of all, let's answer why we need artificial intelligence in healthcare. Why only human intelligence is not sufficient. So why we will say human intelligence plus artificial intelligence in healthcare is the future to go. That means human intelligence enabled through artificial intelligence is the future to go. Because why we need? Because rising patient volumes, more and more patients, shortage of healthcare professionals, less and less doctors, right? So that's why we need artificial intelligence to augment the human intelligence. The complexity of medical data. So data is becoming more and more complex. That means we have more data, but it's more complex data because we have a higher technology advancement in all the testings, higher technology advancements. So we are getting more and more data now. So the complex, and that data is becoming more and more complex. So that is why AI in healthcare is required. Demand for precision medicine and personalized care. So people are asking for it. Previously, people would not ask for precision medicine. Give me the right medicine and that's it. And they are asking for personalized care. That means doctors should cater to me in my lifestyle. That is how predictive comes more than reactive. So that's the demand for precision. Hence, we would need AI, help of artificial intelligence to augment human intelligence. Then the role of artificial intelligence to enhance the diagnostics, to reduce the cost, and to optimize the outcome. So better productive healthcare at lower and lower cost. And that is very important, specifically for a country like India, that better predictive healthcare, not reactive, better predictive healthcare at a lower and lower cost, because we are 1+ billion people, and lower and lower cost, and we need to optimize the outcome. That means that is why we need artificial intelligence to augment the human intelligence, right? So now let's go to the next slide, which talks about the core technologies driving artificial intelligence. So if we are only talking about one pillar, so you see in the last one I said 5 pillars. Now we are only looking at the first pillar, which is artificial intelligence and machine learning. Even in artificial intelligence healthcare, we have machine learning, we have deep learning, we have natural language processing, we have computer vision, we have robotic process automation, we have generative AI. Yeah. So even in the first pillar, you have multiple tech stack. Even in the first pillar, you have multiple tech stack. You have machine learning to predict the models. You have deep learning to analyze the drug discovery and the image. You have clinical documentations like your chatbots. You are trying to gather more and more data. Then computer vision for radiology, pathology, dermatology. Then robotic for administrative tasks like for admin activities in healthcare. And generative AI means we are now generating newer drug designs, newer drugs, simulating the drugs and designing the newer drugs. So this is in the first pillar, which is artificial intelligence and machine learning. Even there, we have a multiple layers of tech driving that pillar. So that's some of the use cases for clinical applications, which we are including, is medical image analysis. These are all artificial intelligence based intelligent medical systems. So you have you can do alerts, you can do disease progression, virtual health assistance. So artificial intelligence is now being used in chatbots and assistants, so virtual health assistants, whereby you can ask them questions, they can respond. Clinical decision support, so we can use AI recommending treatments. Many people are started using it. Okay, so there is I will be talking more on the what is AI, how AI works, and geometric data analysis and drug matching. So there are a number of applications which we can look at. Now, let's go a bit on the what is artificial intelligence and how it is impacting the use cases in different operational and admin. So we have this clinical application. So let's look at this. So artificial intelligence, where did it come from and what does it include? So when we, in the past, before the AI came into picture, we first got our browser, Google, which we call it Google. Now, in the 1995, when I had joined Motorola, I was shown to my desk by a manager, and he opened the computer for me, and he said, he opened one browser, and that browser was called Netscape. So 1995, there was no Google. There was this Netscape browser, which I came in. I'm telling you this story of my personal journey. And my manager told me, because that time Motorola had come to India for research in technology. That's why they were only hiring masters in technology. So he said that this thing, what you are seeing here, which was Netscape browser, you can put anything in here and say search, and it will go and search, and it will bring the outcome to you. So I was very happy to see something like this, because I don't have to read books now, the big books, and I can just put something in that browser, and it will go search, and it will get the outcome for me. And that Netscape browser, and which he gave me, was only to be used for technology research. So I would not be able to research which movie is in town, or which all the Google search which we do today. It was not possible at that time. So what it was simply doing was, there was a bucket full of data, RFCs we call it. In that bucket full of data, it will go search and give me the right RFC, so that I can do a research using the Netscape browser. Now, so that was very simple search, and then we have seen the evolution to Google few years back, and like we see now, Google is everywhere. We are searching. Now, what is artificial intelligence? Is the next level of search, right? It's the next level of search. Means it not only searches, but it also generates new content based on what you want, and it can bring to you exact replica of what is it that you want, right? So it is a next level of intelligence. In artificial intelligence, there is a concept called RAG, retrieval augmented generation. That means you can tell your chat GPT or your foundation model to search in a specific data. So you can say only search in Wikipedia, or only search in RFCs, or only search the data in this directory where I have kept the data, specific data. So the model behaves, the how the model AI model behaves exactly which data it has been trained on. So that is why there are so many foundation models, artificial intelligence. There are so many because they are all trained on different kinds of data. Some are trained on Wikipedia data or any other data. So before we use any artificial intelligence model, we must be very careful on what kind of data it has been trained on, right? One. Two, if we don't want it to use the data which has been trained on, we can also provide our own data to the model and say, predict or develop based on this data which I am giving you. Now that data you can put in a specific directory, and you can say that use RAG, retrieval augmented generation, and only give me an outcome based on the data which I am giving you in this particular directory. So that is how it's a next level of search, which is that not only it is giving you a blind search on the data, but it can also make smaller decisions based on the pattern of the data. Hence, data is very, very important for a artificial intelligence based future medical systems. So today we are looking at we are looking at systems which can use all this data together at once and gives you an outcome. And that the importance of the artificial intelligence based model is because it is able to read and predict based on this huge amount of data which we are providing it is so the artificial intelligence system is or a bot is completely dependent on the data which it has been provided to. So it is very helpful because human intelligence will not be able to do that so fast. So when I got to see that Netscape browser, it was so much of an assistant, as it acted as an assistant to me, so that I don't have to read these RFCs, but I and search through my files, but I can simply put a search in there and say this is the RFC I want, and it will go and search for it and get it to me fast. So exactly that is how artificial intelligence assistants are developed. So instead of a human cannot do what an artificial intelligence assistant can do so fast and very quickly, and also predict, and also not only predict but generate, which is the next level, that based on the data which it has been provided, it not only able to predict, but it is able to generate new drugs or give us APIs for new drugs. So it can help us to develop very quickly. Now, artificial intelligence here is not only used in clinical applications, but it also is used in operational and administrative efficiency. That means in scheduling, in claim management, fraud detection, in population health management. So it is a highly productive what you call it in intelligence. So when you want to increase the productivity of human intelligence, you augment it with something called the artificial intelligence, which will be able to make decisions faster and be able to read the data faster, may be able to predict the data, predict the drugs faster, and that's how artificial intelligence and machine learning are impacting the future generation, intelligent healthcare systems. So not only in clinical applications, but also in operational and administrative efficiency, but also building in technology stack behind the AI systems. So this is, I'm talking about only the first pillar, which is artificial intelligence and machine learning. So the technology architecture behind AI systems, we have the data, very important data layer. We have the AI and machine learning models, different kinds of models. For example, just give you one of the this, that ChatGPT is based on something called the transformer model, which is a transformer algorithms. So that way every foundation model is built on another kind of algorithm, can be built on any other kind of algorithms. The orchestration, AI pipelines, model deployment. So it's orchestration is, as the word simplify, to explain it in a very simple way, is like an orchestra, somebody who tells what the other people will do and hence create the music. So same way we have something called orchestration in artificial intelligence, whereby the manager artificial intelligence model will tell the servant artificial intelligence models to do what they are good at doing, and then decide how the music will look like. That means decide how the outcome will look like. So it's called a multi-model artificial intelligence. That means you don't use one model, but you use multiple models, whereby one model is a manager model and the other models are servant models. So the manager models, it tells the servant models as to what they need to do, and together when they come back with an answer, it predicts on what the outcome will be. So that's multiple layers, that's called orchestration, AI orchestration in technology. Then integration of various standards, APIs, that is also behind the AI systems. Then another one is security and compliance, which is a very important factor as well, as to how, if you are talking about data, if one is talking about data, then data security is a very important factor, and cannot be, as I said, that ethical AI means that, and data security, there was a question just now, how do you make sure of data security? That is, you create your own data. And be AI ethical is, if you are building an intelligent healthcare system, then you must own your own data. That is a rule. Now, to own your own data, you have two methods. One, you create your own data. Two, you buy the data. And in an ethical way, you buy the data. You don't go into, the dark zones or to go and buy the data, somebody else's data. No. So that's why ethical AI is one of the important part even in the medical systems, and hence data security, we must follow the data security, that is encryption and the data policies, all that has to be implemented while we are building the intelligent healthcare systems. And we had already spoken about the risk, which is that if you build an intelligent healthcare system on data which is not right or not meant for your ethnic group, then the results may be risk. It's a high risk. So if you develop an intelligent healthcare system on data, say African data, and then you want to use the outcome in Indian scenarios, then you may, that's a big risk. So before we use the AI, the models and predictions, and we must know where the data is coming from. Where the data is coming from, and the only way is create your own data, or generate your own data. That's one of the most important part as well. So challenges and guardrails, as we just talked about it. So this, again, I want to repeat, I'm only talking about one pillar, which is artificial intelligence and machine learning, not the rest four pillars. So here, what are guardrails? So when guardrails is like something like when you are driving on a highway, there are iron pillars or rods which separate you, which make sure your car doesn't fall off the road. So that's called guardrail. So that means that when you are building your intelligent healthcare systems, you must always have guardrails using artificial intelligence. So artificial intelligence allows you to have guardrails, risks associated, which needs to be managed. That means your intelligent healthcare system cannot fall off the road on what it is supposed to do. So these are called guardrails in a technology terms. So in technology terms, they are called the guardrails. And when one is building an artificial intelligence based system, one takes care of these guardrails. As implemented in, if you are tech, we will know that in softwares we will say a greater than equal to 100, less than equal to 1000. So we are defining the guardrails that 100 or 1000, between the 100 and 1000, then our system will work. So similar kind of tech is in the guardrail. It's called the guardrails. So that's also the regulatory compliances like FDA, CDS regulations, and a lot of medical regulations we need to comply to when we are building the intelligent healthcare systems. And interoperability and data silos, that means so data should be interoperable, and data cannot be like one part of like one. We are taking only one sample from one place, data silos. So that should not be. It should be taken from all samples, all kind of backgrounds, all kind of age groups, all kind of gender groups. So interoperability of data, ethical concerns, consent that it's a liability in misdiagnosis. So these are some of the challenges which are there when we are building our intelligent healthcare systems. We need to have the three parties, which is the regulatory bodies, the technologists, and the domain experts must work together. So they cannot be working in isolation. Then emerging trends and future outlooks, multimodal AI, just spoke about orchestration, terms which are related, whereby you use not one model but multiple models. So I'll give you an example that say ChatGPT is one model. So we have XYZ GPT, another model. We have ABC GPT, another model. We have EFG GPT, another model, and all these models are trained on different kinds of data. Now we can use a multi-model AI or a manager AI, which can ask questions or get feedback from all these different models which are trained on different kinds of data, and then consolidate or predict an outcome or based on the outcome from all different models. So that's why we are using multi-model AI. Now this, imagine, if you imagine a scenario like this, we will say one model is trained on data from Africa, the model is trained on data from Europe, the third model is trained on data from Southeast Asia, the fourth model is trained on data from another group of people. And then when we are building an intelligent medical healthcare system, we use a multi-model architecture which takes the outcome from each different models and then uses the output to predict, making it more intelligent. So that's how we are saying combining images, combining genomics, combining nodes means every model may be trained from a different kind of data, and then we combine integrate all the outcome into one outcome. So digital twins for patient, we just said that we have personas, means that kind of similar what you call it, persona for patients, and which can help us to predict the outcome, and it's a pattern based again. Then we have the federated learning for privacy preserving AI, so which is based on security, AI powered robotics in surgery, generative AI for clinical simulation and training. So these are some of the future things which we are looking at. We have already spoken about this, so we will not. So we can see that AI can transform every layer of healthcare delivery. Innovation must be grounded in ethical clinical design. That is very important, specifically for healthcare, because we are here. It can impact a lot of things, including our future population or future generation, how it will look like. So innovation, it must be grounded in ethical clinical design. And how we need to ground it, if you are using artificial intelligence, and we are talking about ethical artificial intelligence, is most important. Top number one is data must be owned by the person who is developing the intelligent medical system. In that, your data ownership must lie with you. Collaboration is the key between the technologists. Like me, I'm a technologist. I call myself a technologist. Then there are doctors. Many of you may be doctors, or they know hospitals. And there is a regulatory body which is in the country, a regulatory body which regulates what needs to be how the healthcare is going to be provided in the specifically countries like Singapore and UK, where the healthcare is owned by the government. So where we have working, where it's a very different approach. The NHA, or National Health Service, NHS, owns the healthcare. Now here there is hardly any scope for hardly any scope for error, because it's completely regulated. But in countries like India, where there is need for collaboration, as the NHA is still not, there is no national health association or national. I mean, there is, but it doesn't work like how it works in the other countries. So it's a collaborative approach, and regulatory is where the government regulations come in, and we need to work together with the regulatory body to create these intelligent health care systems. So I think that's it. If there is, we can take questions. I think a lot of
Yes, ma'am. Good evening.
yes, hello.
Ma'am, can you please put some light on one of the research which is conducted by Google, that it is under the umbrella of AI only, that the AI system is analyzing the images of the retina and then predict that what are the chances of cardiac arrest for a patient.
So you're saying so I'm not aware of this intelligent system. So Google which is prepared by who?
One of the research conducted at Google by Google Lab.
So I think I understand. I'm not the right person to talk about it. First thing is that we need to understand, is Google the right body to conduct that research? If they are, anybody can do research. I mean, U2U system as Google can also do their research and publish a research. But how can you trust that research which is coming from whom, whether it is only for making money, or whether it is to help the people, whether it comes under any regulatory body, whether that research has been approved by somebody that's saying that yes, this is right, or whether clinical trial, what we call it, has been conducted on that outcome of those research. So there are a number of factors which impact so I wouldn't be able to say more, but just to give you some background, as that it has to be confirmed by somebody, I don't know, FDA or ICMR or XYZ, that yes, or some trials have been done, and then a product has been designed. There are numerous research papers from different bodies.
Thank you, ma'am.
Is privacy and data governance different for different countries? It comes under the regulatory body for every country. Like in Singapore, we have something called PDPA Act, Personal Data Protection Act, and the similar act may be also there in India, but may be called something else. And in this act, as per this act, Personal Data Protection Act, if I am collecting at U2U system, if I am collecting any data from the public, then I am responsible for the privacy of that data. So that's all about it. So if any organization is collecting a public data, then the privacy of that data is the responsibility of that organization. And that's an act in Singapore, as well as there might be an act in different countries, maybe slight variations. but it's the same, that privacy of data is of utmost importance. Did I answer your question? I don't know. But one thing is for sure, it will be different for different countries. So you have to follow the country regulation on data privacy. In technology, when we work, in technology, when we work on data, even if it is a multinational company, so I have an office in Russia, or I have an office in Australia, or I have an office in India. Data cannot be moved outside the country of that country without the permission of XY of the regulatory body. So every organization has to follow it. So we do have, I think this data privacy is of utmost importance. So another thing is that when I'm building an intelligent healthcare system, and tomorrow somebody is coming to me with an artificial intelligence model saying, you can use this model for this building your intelligent healthcare system, then the first question I will be asking that person is, your model, can you tell me what data it has been trained on? That is transparency. So I will not build my intelligent healthcare system on an artificial intelligence model, which I don't know what data it has been trained on. So if I'm buying your artificial intelligence model, you have to tell me what data it has been trained on, because I'm paying for it. And if I'm using a free model, somebody is giving me a free model, and which is called the open source model, then I'm going to tell that person that you make your data transparent because it's open source. Right? So I must know which model, which data the model has been trained on before I build my intelligent healthcare system on your model. So that's the relationship between intelligent healthcare systems and the data. Because this is now completely different scenario. It is on about patterns. So if the pattern in data is incorrect, my intelligent healthcare system will go ways of no use. It is going to give me errors. Did I answer your question on this data and intelligence, how closely they are coupled? Hence, we coming back to the same thing. If you are building your intelligent healthcare system, make sure you own your data. Or make sure from where the data is coming from and you are trusting that data. Okay, ma'am. So if I think I'm done. If there are more questions, I can take it, and then we will.
Over to you, Sadia ma'am.
Participants, anyone else who want to ask question? Yes, anyone else? Okay, no. Okay, thank you so much, ma'am. Thank you,
Thank
Ritu, Gaurav, ma'am, for
Yes,
the insightful and thought-provoking session on intelligent medical systems and throwing some light on its emerging trends and its future scope. Thank you so much. And thank you so much for gracing today's event as a chief guest. Thank
it's
you.
my pleasure. Thank you for inviting me. If it is helpful to, please always feel free to ask any more questions, and you can send me by WhatsApp also later, if there are questions back, or email. Thank you.
Thank you, madam, so much.
Thank you, sir. Thank you for inviting
Thanks
me.
for accepting our invitation
Yes, sir.
and delivering a nice session. Definitely, we will be in touch with you. Help
Yes,
and guide us whenever we require any help.
for sure, sir. It's I'm blessed to be here, and whatever we can contribute, we will be very good, happy to contribute.
Thank you so much.
Thank you, sir. Thanks. Bye. I'm exiting now.
Yes, thank you so much. God bless you.